Hello, I'm Robert Del Junco. I'm one of the many physicians at St. Joe's Hoag Health. I would like to thank Chris Dixon, who's my patient who passed away from cancer, for her generous financial support for this film.
I think back and I think I chose joy. I chose joy to be my guiding force.
It allowed me to be a daughter as opposed to the nurse.
You know, I think it's extended his life quite a bit and provided a lot of opportunities for him to maintain normalcy.
I always had the misconception that hospice is only for the last couple weeks, maybe 4 weeks at the most, the last. In fact, my mother and father both had hospice the last couple weeks of their life, and I had really no idea that they can enter the picture far before that and be of such help. You know, the biggest thing that was a plus for us to have him in his home and with hospice care was that he was such a lover of his garden, and he took very good care of it. And so from his bedside, he could see this green grass, he could see the bushes, the flowers, and he was a very particular gardener. And I remember a nurse, relatives telling me that they do so much better staying at home, and I thought, yes, that's what I want to give to him, the loving home experience, and I can do it. And it was so gratifying to know that we were giving him a little bit of happiness through the very difficult times of his decline. The hospice team treated my husband so well, and I felt like they were family. Johnny the bather was a delight, and it was nice for him to have a man within the lineup of his team. And he would come in brightly and saluting my husband, acknowledging the fact that he had served our country in the Second World War. And he sang with my husband in the shower. They both were singing at the top of their lungs. He was such a ray of sunshine, and he treated him with such respect and gentleness. It was a real pleasure to watch him. Then there was Susan, our chaplain, who, when she came, would talk to him and pray with him, and I really felt like he got something out of that and felt blessed over her being there. She and I would sit in the living room, and I was able to sort of unburden my concerns and got so much comfort and strength from her prayers and her just giving me confidence in what I was doing. And knowing that hospice was just a call away, that during the night, if I was frightened over something, wondered what to do, they were right there on the phone. It also provided, by hospice saying, it looks like maybe another week, that the 2 days before he passed, his grandson, his granddaughter, his daughter, all were here to see him. And even a phone call to his son, who was upstate California. So I was so glad that they were able to guide us in that time and have that all into play, so that he had seen everybody when he left us. Having hospice was really a lifesaver for us, to be able to somehow grasp as much happiness as we could.
You are in my hallowed ground. This is my garage. This is where I would spend all of my evenings. There would be a kid in the neighborhood whose skateboard was broke, and I would fix that or fix their bicycles, stuff like that. I can still have fond memories of what I did have here and what we were able to make and along that line.
When Marvin was in the hospital, the doctor came to me and told me that it was time to leave the hospital. And I had to make the decision of what we were going to do with Marvin, whether the options were to put him into a facility where they could take care of him or to bring him home.
Being home for them has meant just so many things. The comfort of the familiarity of their own home, the privacy it offers. You know, they have healthcare folks in the house, so it's not as private as it has been in the past, but it's way better than if he was in a facility of any sort. His ability to be around everything that he knows and relates to. What was the big surprise was how helpful hospice has been and how it didn't exactly spell the beginning of the end like the doctor had kind of predicted.
Well, I am very grateful that I get to be home. I know because I was in a facility for a good period of time before I came home. So I had a chance to compare what it was like in the facility and what it was like to be home. I know that since I've been home, it's a lot more work on the wife, but that's where the caregivers come in. And hospice comes in also. They come in and do help with the social worker, with the lady that sang to me.
When we go down to San Clemente to have a beach party, these are things we've been doing for years. And when Marvin first broke his neck, we didn't do it. We stayed at home and we thought about it. Finally, we said, you know, Marv, you can do it. Let's try it. So we did.
Going to the beach has been a lot of fun. And it's a chance there again to meet with my friends. Lots of times we'll have 10 or 12 people down there. We'll build a big fire and roast weenies and do all kinds of stuff like that. It's nice because I'm not limited, because I've got the stuff on the halo and so forth, and the people, everybody there makes it nice for me.
My dad treasures that, and he does pretty good being able, because of the things that have been provided to him through hospice and the other stuff, that he still gets to my nephew's games, my nephew's soccer games. He came down and just saw my son off as he was leaving for the Navy, which was very important to us because my son's going to be gone for a while. So we're incredibly grateful that he can get out and do those things still. People
think that hospice care is the total end, and that's it. There's no life left in you. And I have to tell you, Marvin has proved it wrong, that that's not so. He has gone on and on and on, and he's getting the most out of life he can, and he's enjoying it, and he's getting lots of help from hospice.
My dad's attitude is a message to anybody that's kind of in the very severe health crisis, and that is, keep it positive, keep looking to the next day. And because of that, he's explored everything that hospice and all the services available to him can offer.
My name is Susie Mabey, and I've been an oncology nurse here at St. Joe's for almost 30 years. My mother was on service with hospice for not quite 2 weeks. Had I known then what I know now, I probably would have put her on hospice a lot sooner. But just from the standpoint of the services that hospice has to offer, I mean, I didn't realize it was like a full scope of personnel like you have in the hospital, because you have nurses and spiritual care and case managers and social workers, and they basically can tend to anything and everything that you might need. So as soon as we made the decision, even though she had oxygen, that went back to the company, and hospice brought in oxygen, and they switched out the beds, and everything that we had, we really could have made arrangements through hospice instead of doing it on our own. So I truly believe we could have benefited from hospice much sooner. If there's anything I could say about hospice to the clinicians and the medical professionals that I work with, I think we need to look at hospice as a benefit. I think it's a time that we can look at quality of care as opposed to it being a terminal time of life. It if we do it soon enough, it gives families the opportunity to find closure, I think. You can say the things that you want to say to your loved one. You can make arrangements, you can make plans, you can reminisce, you can enjoy those memories together. And, even just getting your affairs in order. And I think because we wait for it to be so late, that you don't always have that opportunity. So if we could look at it more as a benefit, I think we also can teach and kind of help the family understand what end of life is like, maybe what to expect. Being because I work in a hospital and I've seen a lot of death and dying, I think there's advantages to being able to die at home, and I think that's where hospice comes into play. A lot of people like to be in their own surroundings and be able to have their family around them. In the hospital, you're always being interrupted, and you have to have the caregivers doing things. If you can find the comfort of your own home and have your family all around you and still get the care that you need, it's definitely advantageous.
When someone is agitated, experiencing pain and nausea and other suffering, and those needs aren't addressed, they can't deal with the other more important things: spiritual connection, of connection with their families, of dealing with the end-of-life issues that we all do need to deal with, because the symptoms are out of control. Once those symptoms become controlled, the secondary issues are easier to deal with. And I think that's one of the great blessings we provide patients on hospice.
Some of the misconceptions that we tend to hear quite a bit about is that hospice comes in and we will hasten, the patient's death, and that truly is not the case. When we come into a patient's home, our primary goal is comfort care. We don't prolong life, but we definitely don't hasten it. We just let nature take its course. The biggest surprise that I think families tend to get from hospice care is just all the services that we have to offer. The pre-bereavement that we have, as well as the bereavement that occurs, the bereavement counseling support that occurs after a patient passes, up to about 1 year.
I think one of the great benefits of hospice is that patients don't have to come back to the hospital. We can deal with virtually all of the symptoms that they experience at home or in the facility where they may be. There are very rare instances where patients do come back to the hospital for unexpected acute illnesses. We had a patient who had a leg fracture, and that couldn't be dealt with in the home setting. But the vast majority of our patients don't have to come back to the hospital. They're taken care of at home with family present and in an environment that they choose.
One of the goals of hospice care is education. So we want to transfer this education to patients and their families, and the earlier the better. The patients want information, and we want to transfer control to the patients and their families. The patients and their families don't want us to use big words. They want to understand next steps. In my own experience with my patients, what they want to understand is what are the next steps that they need to do to move forward. Our staff is highly trained to conduct difficult and challenging conversations with seriously ill patients and families to better understand what gives meaning to life and what matters most.
I think hospice enabled us as a couple to have a little bit more normalcy in our marriage. I was able to just do things for him to show him that we were still a couple, that we were going to see this through together.
It was just fabulous, and I regret not doing it sooner, and the people are wonderful. And when my mother did pass, just the support that you get afterwards.
Hospice has been it's been a wonderful experience for both of us. Sometimes I don't know how we would have gotten by without them.
Coming on hospice early has opened up a whole new agenda for me. I mean, the way to go, the way I want to go. This has been opened up to me. It's things I never thought were there available.
The purpose of this film was to use real patients with their real stories to educate viewers about hospice care. This is what gives St. Joe's Hoag Health meaning. This is what gives our family meaning. And this is what gives me great pride as a physician and a caregiver.